Hello, everyone. My name is Mallory Hooker, and I am a Simmons University dietetic intern, currently working with the Southwestern Vermont Council on Aging. And I'm going to present to you a little bit of nutrition for diabetes. So, to begin with, what exactly is diabetes? There are two types there's type 1 and there's type 2, and there's a couple of differences between the two that make them notable. Type 1 diabetes is a genetic condition that shows up early in life and tends to affect approximately 8% of those with diabetes. In type 1 diabetes, the body attacks the cells in your pancreas, which means that your pancreas is unable to make any insulin. Therefore, you do not have insulin available to help take the glucose from your blood into your body's cells to be used for energy. This leads to high levels of glucose within your blood. And because this type of diabetes is a genetic condition, the risk of development is not impacted by your lifestyle or your weight. Some of the most common symptoms are needing to go to the bathroom, being very thirsty and tired, blurred vision, losing weight unintentionally, and longer time for wounds to heal. Some of the management options for type 1 diabetes are taking insulin to control your blood sugar, regularly testing your blood glucose levels, as well as adopting a diabetic style diet via carbohydrate counting. The overall recommendation is to try to live a healthy lifestyle with regular physical activity and a healthy, balanced diet, which will help to decrease your risk for complications related to uncontrolled diabetes. On the other hand, there's type 2 diabetes, which is mainly lifestyle related and tends to develop over time. This type of diabetes affects approximately 90% of those with diabetes. In type 2 diabetes, either the body doesn't make enough insulin or your insulin doesn't work properly, which is called insulin resistance. This produces the same results as in type 1 diabetes, where you will have high levels of glucose within your blood because of this lack of insulin. There are several things that may put you at an increased risk for type 2 diabetes, which include your family's history, ethnic background, age, and weight. However, it has the same symptoms as seen in type 1 diabetes. Individuals with type 2 diabetes typically need to take medications in order to control this type of diabetes, but the need to regularly test your blood glucose will depend upon the type of medication you've been prescribed, as well as if you're also using insulin to control your blood glucose levels. Similarly to type 1 diabetes, it is recommended that you try to incorporate a balanced, healthy diet and incorporate regular physical activity to help manage both your weight and diabetes. Now, a little bit of diabetic education. The long-term complications will develop gradually. The longer you have diabetes and the less controlled your blood sugar, the higher the risk of complications. Eventually, these complications may become disabling or life-threatening. You're at risk for cardiovascular diseases like coronary artery disease, heart attack, and stroke because of uncontrolled diabetes can impact the thickness of your blood and the health of your arteries. There's also a risk for neuropathy, which is also known as nerve damage. This is because high blood sugar levels damage the walls of the smaller blood vessels within your legs, arms, hands, and feet. You may experience some tingling, numbness, burning, or pain within these areas and eventual loss of feeling if left untreated. Additionally, there is risk for nephropathy, which is kidney damage. This is because the kidneys also contain tiny blood vessels that can become damaged with high blood glucose levels. Therefore, the kidney um, the kidney becomes damaged and do not function properly. Some other risks include retinopathy or eye damage with potential blindness if not treated, foot damage due to poor blood flow, skin conditions like bacterial and fungal infections, and hearing impairment. Despite all of these complications, there are several ways that an individual can manage their diabetes in order to decrease their risk. This includes eating a healthy, balanced diet and incorporating regular physical activity, both of which will help with blood glucose levels. Exercise actually lowers your blood glucose levels because it moves the glucose into your cells for energy. It also increases your sensitivity to insulin, which means that your body will need less insulin to transport sugar into your cells. Another way to manage diabetes is by regularly checking your blood glucose levels to make sure that they don't get outside of your target range. This can be done with continuous glucose monitoring or regular finger sticks. Other ways to manage your diabetes are insulin and oral medications as well as other medications. There are short acting, rapid acting, and long acting insulin depending upon your specific needs, and it is injectable. Another option would be to use an insulin pump, which is a device that you can program to deliver specific amounts of insulin depending upon your goals and your lifestyle habits. Sometimes other oral or injected medications are prescribed as well as to help stimulate the pancreas to produce and release more insulin or to inhibit the production and release of glucose from your liver. There are also other medications that can block the stomach or intestinal enzymes that break down carbohydrates or make your tissues more sensitive to insulin. Overall, there are many risks associated with uncontrolled diabetes and high blood glucose levels, but there are several options for managing your diabetes. Now, on to a little bit of standard nutrition for diabetes. There's not a specific diet or meal plan that works for everyone with diabetes. It will depend upon the medications you've been prescribed, any other health conditions that you have, and your lifestyle and goals. There are a few things that are most common nutrition for diabetes, no matter the specific diet that you choose to incorporate. These include eating the right foods in the right amounts and at the right times. It is typically recommended to eat a variety of healthy foods from all food groups, such as fruit and vegetables, whole grains, lean protein, fish, eggs, nuts, beans, or lentils, and non fat or low fat dairy. To keep blood glucose levels under control, it is recommended to limit consumption of sugary foods like candy, pastries, sweetened cereals, and cookies, as well as drinks with added sugars and refined grains like white rice and white bread. You may also need to limit the amount of alcohol that you drink, as this can impact your blood glucose levels. Overall, it is important that you eat the right amount of food each day and eat regular balanced meals at the right times to avoid high or low blood sugar levels throughout the day. However, there are two dietary patterns that could be utilized regarding nutrition for diabetes. They are the plate method or counting carbohydrates. The plate method is a simple method of meal planning which puts an emphasis on eating more vegetables. The basics of this method are to fill half of your plate with non-starchy vegetables such as spinach or carrots, fill a quarter of your plate with protein, and fill the last quarter with a whole grain item. This method also emphasizes the incorporation of good fats such as nuts or avocados, but in small amounts, as well as adding a serving of fruit or dairy and drinking water, unsweetened tea, or coffee with your meals. On the other hand, you could choose to count carbohydrates throughout each day and per meal. This method is where you learn to calculate the amount of carbohydrates you are eating so that you can adjust your dose of insulin accordingly. You do this by measuring the food portions and learning to read food labels to determine the carbohydrate contents of the food that you are eating. The main goal with carbohydrate counting is to keep carbohydrates at or below 60 grams per meal and 15 grams or less per snack. Either of these methods are viable options for individuals looking to manage their diabetes with their dietary patterns. Overall, the method that you choose to pursue should be the one that fits best within your lifestyle and helps you manage your diabetes the best that you possibly can. Now, how exactly can the Southwestern Vermont Counseling on Aging and Meals on Wheels help you? Meals on Wheels provides diabetic meals that contain no more than 75 grams of carbohydrates per meal. The diabetic meals that you receive from Meals on Wheels can help you manage your diabetes because of the consistent carbohydrate content. This will ultimately help to limit the risk of blood sugar highs throughout the day. And here there is a sample menu that shows you that it's approximately 70 grams. It incorporates chicken breast, which is 0 grams of carbs, one medium biscuit, which is around 27 grams, half of a sweet potato, which would be about 20, one small orange, which would be 11 grams of carbs, a cup of a side salad, which is 0, and an 8-ounce glass of milk, which would be 12 grams of carbohydrates. And below is the contact information for Meals on Wheels and the Southwestern Vermont Council on Aging. I hope you've enjoyed this presentation, and if you have any questions, feel free to use the contacts that I previously listed to reach out.